Hello, my name is Wendy James, and today I'll be interviewing Dr. Maria Fleureau from Casuarina Dental Family and Holistic Care, and we'll be discussing the topic of amalgam fillings. So, Dr. Maria, what are amalgam fillings?
Well, when the amalgam fillings are also known as silver fillings, metal fillings, or mercury fillings. When I graduated, I learned that even though those fillings may contain more than 50% of mercury, the mercury was believed to be stable once it was mixed with silver, copper, and tin. What we know these days is that once the temperatures rise around those fillings, we may start having some leakage of mercury happening from those. So every time a person with an amalgam filling has a cup of coffee, tea, fever, or even by the fact of chewing on those fillings, we may have some mercury leaking from those.
Why is it so important to get your amalgam fillings assessed?
Well, one of the reasons is that mercury has been related to a few conditions such as Alzheimer's disease, depression, anxiety, thyroid conditions, kidney conditions, and so on. What we know these days too is that after a few years of function on those teeth, so chewing with those teeth that have the amalgam fillings, we tend to see a lot of cracks happening on the actual tooth structure. So we know that cracks may lead to decay. They also may lead to tooth fracture that may lead to root canal treatments or even losing the tooth that has had the fracture. So in order to prevent that from happening, it's really important to have those fillings assessed and to make an educated decision whether we should keep them or remove those fillings.
And what is the procedure to remove amalgam fillings?
Because of all the toxicity that has been related to mercury, we follow a very strict protocol here at Casuarina Dental. We place a rubber dam around the actual tooth that's going to be treated. We also give our patients a mask with oxygen to breathe throughout the process. On top of that, we take special care of how we're going to dispose that amalgam, and we use an air filtration device to help and minimize any vapor that's available in the air, in the surgery, and ultimately on the planet.
Well, thank you very much, Dr. Maria, for your time. And we just would like to extend an invitation to yourselves or other people you may know who have amalgam fillings. If you have any inquiries or just interested in anything you've heard on this video today, we'd love to hear from you.
Thank you for watching. I hope we could help you to make an educated decision on your amalgam fillings assessment. We hope to see you soon. Bye.
Bye.